Have you ever looked at a Y-shaped laceration and wondered, where do I even start? You're not alone. Y-shaped wounds are one of the more challenging lacerations to close. In this video, I'll show you a simple and effective technique to close a Y-shaped laceration step by step. Before placing your first stitch, always assess the wound carefully. Make sure it's clean, well irrigated, and that any devitalized tissue has been managed appropriately. The key to a good cosmetic result is proper wound preparation. Now, identify the value of the Y-shaped wound. This is the point where the two wound edges meet. Instead of starting from one of the outer limbs, your first stitch should focus on bringing this central area together. Take your needle and enter from one side of the valley, maintaining an equal distance from the wound edge. Pass the needle through the dermis and exit into the wound. Then, take a matching bite from the opposite side, making sure both bites are symmetrical. Equal bite size and equal depth are essential for precise wound edge approximation. Next, take the remaining bite on the third limb of the Y-shaped laceration as demonstrated. Once all the bites are in place, gently pull the suture to bring the wound edges together. Now, tie a secure square knot. Tighten the knot just enough to approximate the skin edges without excessive tension. Over-tightening can cause tissue strangulation and may leave unnecessary suture marks. After the central Y has been accurately aligned, the rest of the wound becomes much easier to close. Complete the remaining edges using simple interrupted sutures, spacing them evenly and ensuring proper edge eversion. This distributes tension evenly and promotes better healing with an improved cosmetic outcome. Remember, the goal of wound closure isn't just to close the skin. It's to restore normal anatomy, minimize tension, preserve blood supply, and achieve the best possible scar. Like every surgical skill, suturing improves with deliberate practice. Practice on simulation pads, fruits, or other training models before performing these techniques clinically. If you found this tutorial helpful, don't forget to like the video. Subscribe for more.